We are back. Welcome back to Daybreak. Before we took the break, Teresa, I really wanted to jump in and touch on something before we go back to Honorable Pasaris. And Teresa, even as you do this, so after this ruling, will training for healthcare workers now be revived? Have you gotten any feedback from the Ministry of Health? Have they reached out in any way to say that this is the way forward, even though we know they're in consultation?
Okay, so one thing, they've appealed, so we are not expecting any quick cooperation now, but the court order is that immediately on that day when they pronounced it, we immediately reinstate training of medical doctors. So we expect an obedient ministry that obeys the orders of the court would immediately reinstate the training. They are aware of the order, they've been served with the order, so our expectation is that. But like I said, they have appealed, so that might cause a bit of cooperation on their side. But what I wanted to really jump in is Kenyans, there's this consistency of protection of life. But all I hear every time is the life of the unborn child. So I won't go the legal way because there's a whole discussion around whether that is life without the mother's body. I'll save Kenyans that debate. But then, do we count also the life of the woman? Or the life that we keep talking about is only for one person, the unborn child in this sense? Do we also care about the life of this woman carrying, or is she just a vessel? So that when we have this debate of protect life, which life are you talking about? And one of the things that I've said is that that is not a debate as Kenyans we will ever win. Because we don't want to put Kenyans in a situation where we are asking them, do you love the baby more or the mother? Because it's not possible to love.
It's like choosing your favorite children.
Exactly.
Right.
So it's not possible. So that's not a debate we should engage with. The church, ourselves as NGO, human rights activists, let's not enter into that debate. Right. What we should ask ourselves in reserving life, if the mother's life is in danger, allow her to get it safely, to get abortion safely. If that pregnancy is no longer viable, let her get a safe place to have an abortion. Because when she has already made up her mind, the health that the court described, that it's health of mental, physical, and social, trust you me, nothing stops them. So, because if there was anything that was stopping them, we would not be having 300,000 deaths in a year in Kenya.
All right, so Teresa, how do you then respond to this specific question? We've seen, and I've also both talked and read accounts, or rather cases of women, let's say we legalize abortion. So how do we make sure that that service is not taken advantage of? When I mean that, so here's a woman, I get pregnant, I wasn't intending to get pregnant, so I abort it. A year later, oh my goodness, I'm pregnant again. 6 months after that, pregnant again. So you find out that, you know, in a lifetime of this woman's, the lifespan, during this period, she's had, what, 3-4 abortions? And it's not because of rape, it's not because her life was at stake as a mother, it's because, oh my goodness, I'm pregnant again. So how do we make sure, even though the courts were to legalize it, how do we make sure that that service is not taken advantage of?
I'll tell you, it's a multi-sectoral approach. So first, we need to go back to the statistics of access to contraceptives in this country. We'll tell you, like, I think...
because in America, due to access to contraceptives, the number of abortions have actually gone down.
Yes, exactly, in a big way. Not America only, but there are several developed countries. Yeah, so access to contraceptives should be increased. Then we will reduce the pregnancies, because I know that's what we are talking about. Yeah. That will really go down. Like today, just try and walk around, even in just pharmacies, and ask. You'll find a lot of the affordable, easily accessible contraceptives are not there. Women are not able to access it. So that's one multi-sectoral approach.
Why? Is it because they're not there, it's expensive?
One, they're not there. In some areas, they're not there at all. And in some areas, they're expensive. So it's about accessibility and affordability.
Right.
So, but in Kenya, there are areas where it's not there. I mean, you're still talking about sanitary pads access in this country. So you can only imagine when it comes to contraceptives. Then it will highly reduce that. Secondly, we also reduce the power relations in this country. Gender equality is real, because sometimes even when you have those contraceptives, we know of so many people who are told, if I find you using them, women hide in the bags. You really even hide at the neighbors or under a tree somewhere so that they cannot see you taking it. Those are also things we need to address and talk about them, and move away from this aspect of we were born to kujaza dunia, you know, like just, we need to work on that. Then thirdly, I want to tell you something, that the responsibility to check whether the mother's life is in danger or not, it's not the mother's decision. It's a decision by a healthcare provider. That is what 61% of Kenyans went out to vote for the Constitution, that if you want to get an abortion in this country, a health practitioner must give their opinion. So that responsibility also now lies with the Ministry of Health, the same ministry that we are expecting to protect the life of the woman. Yes.
Okay.
So it's not on demand. It's not like you wake up in the morning and just decide, I'm doing it. There has to be a report by a health practitioner that you really need this.
Now, you've brought in the issue of voters.
Yes.
The same voters are the ones that pay taxes.
Yes.
What if voters feel like, I don't think my tax should be therefore used to fund abortion? So now, generally speaking, as a nation,
we have to go back to a referendum. Yeah, because it's a referendum that makes the constitution.
Okay.
Yeah.
That discussion will take us to the referendum discussion. Honorable Passaris, you referred to America, you know, a country where people can, the voice of the people is reflected depending on their different views. But we're seeing something interesting in America. 4 states passed what they're calling a heartbeat bill this year alone, banning abortion as early as 6 weeks into pregnancy. And so we're seeing something happening there as well. Just reference that, even as you gave us your opinion.
That is Trump. That is Trump and his administration, and it's a Republican who are conservative. They are thinking. But I want to move away from America. Let's go to Ireland. Ireland has got almost 80% Catholic. All right. Ireland legalized abortion last year. All right. Why? Because they saw that majority of their women were actually going to the UK to do it. When a woman wants to procure an abortion, she's going to procure it. When a woman doesn't want a child, she's going to procure the abortion. Now the question is, how do we give her a safe abortion? Do we want to wait for her to go and procure it without guidelines and standards, backdoor to a quack, and then she comes back, and the right to health care, emergency care? When you have had a botched abortion, it's emergency care. So you cannot be turned away from the hospital. And I don't see anybody going to the hospital and arresting all those women who've gone through botched abortions. They go for the clinic. Why go for the clinic at that particular stage? I was recently at She Delivers, at Women Deliver conference, and the former Prime Minister of New Zealand was there, Helen Clark, and she said that what we need is to get mentors. So you get the women, the young girls who got pregnant in high school, all right, to come to school and mentor the girls who are still in school with their babies. Do you know, if we took all those girls in high school to go and spend a day in an orphanage where they're dealing with little babies, and you tell them, this baby requires milk, this baby cries all the time, do you know they will think twice about having unprotected sex? And that's why you see commodities like birth control. Children in Europe up to 15. When a country adjusts according to its social ways, you know. So in Europe, you've got some countries that have actually said at 15, a girl can go and get contraceptives without her mother knowing. She can actually go and get contraceptives, and you have no right to even go with it. If I went to a hospital with my daughter once in the UK, and the doctor asked my daughter, "Do you want your mother to be here, or do you want to be alone with me?" You know, and I realized that my daughter at 15 can actually see a gyno without me, and she can be whatever. You can decide with the gyno.
But as a mother, would you want your daughter going to get contraceptives?
Okay, let me give you an example of my daughter. Okay, my daughter at 16 came home and told me, "Mom, my girlfriend is pregnant, and she wants to go for an abortion. We were raising money for her to go for an abortion, but I feel something's not right. You know, what if she dies? You know, I don't want that." So I said, okay, well, then we have to go and talk to the grandmother. This girl actually didn't have a mother. She had a grandmother, and we talked to the grandmother. All right, and she did procure a safe abortion. All right, then there's another girl who got pregnant, had the child. All right, and actually she passed on, because when she had the child, the boy continued with his life, partying with other girls, and she was left on her own to raise this boy on her own. Okay, I want to tell you that when we're putting these laws, we're actually putting them against the very, very poor, because the rich will procure abortions. You wouldn't even hear about botched abortions with the rich. All right, but the poor are the ones who are going for these abortions that end up botched, and that's why you have a whole war dealing with it.
Okay.
When I looked at my daughter, I asked myself, my daughter is 16, her friends are already having sex. All right, I had sex at a later age. My mother didn't know when I was having sex. All right, so at the end of the day, I felt that it's important to take my daughter to a gyno, and I took her to my gyno in Nairobi, and I said to my gyno, I want her on the pill. Put her on the pill. At the age of 16. And my daughter says, "Mommy, why are you putting me on the pill? I don't want to have sex yet." I said, "No, baby, it's not because I want you to have sex. But if you're going to have it, I want you to make sure that you don't get pregnant. And the reason is, It can happen. You can be out with your boyfriend, you start kissing, holding hands, and before you know it, you've had sex. Then you're on the morning after. You know, so all I'm saying is that parents have got to be realistic. All right, so by putting my daughter on a birth control, I made sure that abortion doesn't become the birth control.
It doesn't become the conversation in your household.
Yes.
All right, Martin, let me rope you in. What about those ones who are pro-life that say adoption is an option? If you don't want to have the child, then have the baby, but then put it up for adoption. I'm sure any of our parents here would have aborted any of us if they also didn't want to have us. So is adoption
an option?
An option?
Thank you. Adoption would be an option if you have that choice and you make that conscious decision. I think what the standards and guidelines provide for it was an array of options. One, information. Two, termination. All the options, including adoption, the choice is, including counseling, the choice is for the woman to make. But what we are saying is, one, that abortion is a reproductive health service that at some point in the life of a woman, they may need it. What you cannot do is to deny a woman who qualifies for that service access to that service. The decision, it is not that it is compulsory, that if we assess that your health or life is at risk, you must. The decision ultimately is yours, but the opinion that that service is available to you is the opinion of a trained health professional. We therefore can now, and the court was very clear on this, as a right, then you cannot take it away without, you cannot take it away. And two, the conversation we need to have should be the right conversation. Are we creating a favorable environment to wholesomely protect the health of women and girls in this country? One of the major issues is the issue of stigma. Are we perpetuating a stigma? Why is it, for example, we do not have this discussion when it comes to treatment of malaria? But when it comes to dealing with a life-threatening condition, a health-threatening condition, an emergency situation that a woman may find herself in, we now start saying that this is an option, this is not an option. Waiga, if you look at the board behind you,
yeah, I wanted to ask that.
If your cameraman can actually just zoom.
I don't know that he can
but
do it
that
right
tells
now.
you, that tells you our mindset. That rather than promoting access to comprehensive wellness of women and girls, because of our persuasions, whether religious or otherwise, we take stances that actually threaten the existence of part of the population, the poor women and girls. Let us facilitate access to abortion services within the law to protect the health and life of the women and girls. Nobody needs to die for preventable conditions.
Okay, thank you so much. That's how we're going to have to wrap up this discussion right now. Again, as we mentioned earlier, we had invited a pro-life campaigner to the program, but they did cancel last minute, so that is why we don't have that voice on that table. We will call you back when we can have them on as well, so that we can have both views. And of course, the Ministry of Health, hopefully by then, will have given clear guidelines. That is depending on how that appeal goes moving forward. Martin Onyango, Senior Legal Advisor, Center for Reproductive Rights, thank you. Teresa Mondi, Executive Director, FIDA, thank you as well. And Esther Passaris, Nairobi County Woman Representative, thank you for joining us today on the program.
Who also sits on the Health Committee. That's why it was very important for you to be here. And just thank you so much for not shying away from having this conversation on national TV. We really appreciate that as Team Daybreak. And speaking of which, we want to take a look at your feedback. Tweets and SMSs have been coming through as we were having this conversation. Let's do that before we take this commercial break.
All right, Engineer Lazaro says, I think at some point legalized abortion would save the country from unexpected deaths. Many young girls are looking for services of quack doctors after missing their normal periods. Very dangerous.
Okay. Still on Twitter, let's see what you're saying. Hashtag Daybreak is our official Twitter. Hashtag Mwalimu, you say, I think we lost focus when we tied teachers' hands on matters discipline. We should know that they stay more with the youth than parents. Let's leave this job to teachers. It's purely discipline.
All right, we also have some tweets, okay? This one is from at Ronnie Onyego 87. Abortion is not a form of family planning, and it is not hypocritical of religious leaders to defend life of the unborn.
Okay. On SMS, 22422, that is our SMS line if you ever also want to churn in into any conversation. Mwangi, you say abortion is not the solution. I think acceptance in case of pregnancies and curbing unwanted pregnancies through education. To Honorable Pasaris, thank you for sponsoring my education. I wish I could reach you. I have a lot to say.
Even called you #my mom. Okay, there you go. Mwangi looking for you. You don't give us your name, but you say, granted, some religions may have extraordinary beliefs, but Honorable Pasaris should refrain from quoting faith on public TV. If we're referencing westernized ideologies, we may as well go off air and broadcast the discussion through smoke signals. Okay. Family planning and most breakthroughs in health matters originate from the West. Pragmatism should not be a reason to abolish faith. Don't give us your name.
Let's see, we still have 2 more SMSs. Comment, you're watching from Eldoret. Good morning to you. You say the elephant in the room is how to tame those professionals who through acts of omission and commission go against the guidelines. Authorities should focus policy administration and not recreationary tactics. These issues are real in society and the Constitution clearly provides for an opportunity to address them.
All right, and one last one here. Let's see who this is from. On via 2242 Dungu Jenga. This is a very informative discussion. I think having a sober talk between parents and children will bring the desperate positive change we need in our society.
All right.
We take a quick break. When we return, a bit of breakfast. Chef Ali, Liz Raburu, stay tuned for that on Daybreak on Citizen TV. We'll be right back.